Welcome to some images regarding a skin biopsy involving a systemic yeast fungal infection, which I myself am fighting and have been now for about 10 years here in Melbourne, Australia. These images are for a microbiologist who hopefully we can find who can compare these independent microscopy images with their own images from a skin punch, because I've been refused treatment by the professional specialists here in Melbourne, and because of the inadequate pathology work being done and the inadequate professionalism of the people I've met, specialists, I've been left in agony, unfortunately, to be poisoned to death by the infection. So this is just the sputum. This is what's coming out of the lungs, and this one of the major hospitals in Melbourne, won't mention the hospital or the person involved, but the head mycologist and the specialist had never seen anything like this before. This is the head mycologist at one of Melbourne, Australia's major hospitals. Had never seen anything like that before. I've got a horticultural background, so I know they look like yeast at the very least, and plus my gardening career has been around a lot of fungal plants, pulling out fungal plants, dead plants that have been killed by fungi. So I had to start doing my own microscopy work once we began getting no results from the pathology lab, saying no mycology, no mycology. So that's what I've been coughing up, and that's spread throughout the entire body. So we'll have a look now at these images, because these are essentially for microbiologists to understand how a patient can be left to die, particularly in Melbourne, Australia, particularly when it involves yeast. Now, my GP, Dr. Monk, gave me voriconazole when we had our first report of a fungi in the lung, because that was where the main congestion was initially until it spread to the chest and the skin. 3 months into voriconazole, this outbreak occurred on the skin, and I'd never had anything like that before. I'd never been allergic to anything in my life, but it seems that the fungus and the yeast had already spread throughout the skin, because this seems to be actually a reaction to the voriconazole attacking the fungi, it would seem, forcing it out of the skin, as opposed to a reaction to voriconazole. I've had a full voriconazole and this has never happened. So that was the first episode. So then we had the chest biopsies. Now these are the really important images for microbiologists who might be handling my skin punches. We're still hoping to find a good microbiologist who's aware of yeast and fungi, and a pathology lab who will report yeast, because the pathology labs in Melbourne, Australia refuse to report yeast. So you can die from a systemic yeast infection here in Melbourne and it'll go unreported. They need to change that, but that's another matter. Now this biopsy was done from the front of the chest after a neurostimulator had been put in under the skin, and then an infection followed it, and the wires ran up behind the back of my neck for some head pain, neck issues, and the infection spread up into the head until I was nearly completely wiped out by the poison it was producing as it followed the leads up. And the people who put it in, the specialists, they refused to take it out for 2 months, and the infection spread. When they did take it out, I did improve after a few weeks, but within a year my whole body was becoming sort of numb and paralysed. Now this punch biopsy was sent to one of our main pathology labs in Melbourne, and they said there's no mycology there, and yet we can see quite clearly here there are microspores and other larger spores throughout the entire biopsy. And because I have a horticultural background, I was trained at a horticultural college. I was taught to use a microscope 50 years ago to study insects and fungal diseases and general diseases, and so I have a good knowledge of microscopy work in my field, but I had to adapt it, of course, to pathology. I only used wet mounts because I found they were just simpler for me to use. I'm not in a laboratory. But you can see the enormous array of fungal spores there, or yeast spores, which go unreported in my body, varying sizes, and you can notice the cell within a cell, which is just here. That cell within a cell, that is a classic cell structure that's throughout my entire body, poisoning my body to death, and every day I nearly die now in Melbourne. This is April the 14th, 2026, and the The amount of neurotoxins in the brain is like meningitis now, but I'm still going untreated. But I'm hoping to find one good specialist or one good pathology lab and to verify what it is and then get some decent treatment, some proper treatment. Again, you can see here the mass that's in the actual skin punch. The one we sent off was right next to this one. The doctor who did it gave me one because he knows of my horticultural career and my ability to use a microscope, and we were wondering why they weren't reporting things in the lung. We soon found out that they were missing yeasts and particularly arthroconidia from geotrichums or geotrichopsis, which has been identified as being in the lung. So there's some simple evidence and truthful evidence and correct evidence and accurate microscopy work done to show that my skin is loaded with this what looks like a yeast infection, and it's right throughout the body now. So that was back in 2019. These large discs we'll see later on at another biopsy a few years later, and these discs actually expand out into very large masses. But these are all part of the infection in my body, and any microbiologist who is looking at my skin punch biopsy, if we can find someone to look at them, they only need to look at these images to confirm that they're seeing the exact same thing in the biopsy themselves. Because I'm not a licensed pathology person, of course I'm completely ignored. And I learnt that patients are worth nothing here in Melbourne. You're worth nothing. I've been treated like a piece of dirt, except for one specialist in Melbourne, and that was Piers Canty. I'll mention his name because he treated me really decently. And my GP has done everything he can to save my life as well. But all the other so-called experts I met, I honestly would have to tell you, I wouldn't send my dog to them if my dog had a fungal infection. That's what I think of them. It's just disgraceful. So this is the second chest biopsy. Now this is in 2021, so the previous one was 2019. Here we are 2 years later, and I'm just getting more and more pain throughout the body, more and more toxicity. So this was the punch chest biopsy, again right beside the one that was sent to the lab. And you can see here that there's a very close resemblance to rotatorula, which has been coughed up out of the lung, and the resemblance is just extraordinarily similar that it can't easily be denied. When you look at the discs and the fracturing of the discs and the way they're compounded, it just seems evident, self-evident, that this is in the body, along with perhaps another one. So the immune system can't deal with it, there's too much of it. Again, this punch biopsy, these are these large yeast-like fungal discs that are growing in the chest. I can feel it all throughout the chest and the back of the chest as well. On the back, it's spread and at the back as well, around the thoracic as well. So this is June 26, 2021. So you can see here under KOH 10%, KOH is a very highly alkaline substance which helps you identify fungi. And I've certainly used the microscope to identify fungi on plants in my career. And KOH is a very common way of helping you see them. The thing about alkaline KOH, when you use it on some yeasts, they respond by creating massive hypha growth. The hypha growth really takes off in the alkaline condition. Some yeasts are susceptible to alkalinity, but some other yeasts are not susceptible. They, in fact, that's the environment they want to push them into hypha production. So this is recorded quite straight out of the biopsy. They're all wet mounts. They're well prepared slides. I've had a professor from a university come to my home and a GP come to my home, and they've both given me statements saying that my microscopy preparation, the slides, they're not contaminated. And certainly the professor at Swinburne University, who came to my home very gratefully, he said, no, your work's fine. You know, you're not in a laboratory, but you can't possibly contaminate your slide with all this, with the way you're preparing it. It's just not possible. So the KOH is stimulating the growth of the hypha. So again, this, you can see just the multiple numbers of these in my body now. And this is 2021, and I'm only just managing to stay alive now. So it's a sort of free-form yeast. It's become very fluid in its growth habits, and it's been hit with a lot of things by now, a lot of different oral antifungals, but my GP said I should be on intravenous antifungals, and also the laboratories are not reporting yeast. The pathology labs don't report it in Australia, not in Melbourne, and you can die of a yeast infection and it'll never be reported and never treated. So it's a really shocking situation. But I'm happy to reveal that situation in the hope of improving it. So I have no wish to sue anybody for their negligence and incompetence. But you can see how the yeast hypha are really stimulated into growth just simply by the KOH 10%, which the labs won't use. So they don't use KOH. So they'll use stains, but they won't know what they're looking at. They wouldn't have seen these things before easily. They're very limited here in Melbourne. So there again, the fungal elements of various sizes. We're still at June 26, 21, and again you can see the elements throughout the skin punch biopsy. Now there's a skin outbreak in July 21, and again you can see the same discs that were there before, and it's still there. And you can see the similar sort of pattern, the clumping, the clustering of this yeast type fungi and the discs, and so it's quite clear that it's there. That was on the forehead. Skin outbreak December 21. This is the chest skin rash. So this broke out on the right side of the chest, and if you look closely there, a bit of scraping of the chest, and you can see clearly the hypha growth. And again you can see over here, you can see the cell with the cell in a cell, circle around the cell. That's the main element to look for, along with these arthroconidia chains, which you can see here running along. The arthroconidia chains, along with straight hypha, spaghetti-like hypha, but the arthroconidia are typical of geotrichum, and that's why they don't understand what they're looking at here in Melbourne. They're not very well versed in these things. Again, you can see it's just an enormous amount there, similar to the skin punch. So the skin punch has gone in deep, and of course it was disinfected. The skin was disinfected before the skin punches, but this rash broke out, and there it is. It's coming to the surface. It's in the adipose tissue. One university, wonderful person at university who tried to get me help at one of the hospitals, major hospitals here. Unfortunately, that person who wanted to help me, he was banned from helping me by a senior person of the department, and it's just shocking the way I've been treated. You just can't believe it. But anyway, not to worry, I pray for them all. So you can see here the skin rash with KOH is clearly seen, and it's the same elements, It's a systemic infection. And again you can see this classic circle within a circle, cell within a cell, and they form these larger discs, and then they just go on to poison the body to death, and that's what it's doing right now. Even as I'm doing this video, I'm barely managing to stay alive, but that's okay. Now here you've got a boomerang type hypha. Now that's again typical of an arthroconidia from a geotrichum chain, which have many different shapes and forms. But either way, it's certainly fungal, and it's certainly yeast orientated, and that's in the skin and in the body and in the lungs, and it's everywhere. It's systemic. An independent lab also said there's a wood fungi involved, and the nearest one would be Ganoderma. I've had to cut down dead trees with fungi in them that have died of fungi, and it's quite possible that there's a fungi in it as well. That's my own, I've had to do my own culturing. I was running 2 incubators at different temperatures here at my own home, my own laboratory, you might say, because the pathology labs were so pathetic here in Melbourne. I had to do my own agar plate testing, and it's really been a real wonderful experience to be involved in it, but of course I'm just treated like dirt, so all my evidence is thrown in the rubbish bin. That was in the blood vein sample, put in brain heart broth, and unfortunately that does seem to be a bit like the wood fungi spores, Ganoderma. Now another skin outbreak in 2022 on the torso. You can see the ridges climbing up on the stomach, and these, I did find what these were, but I've lost the name of them. I've got about 10,000 images at least now, over 5 years, 6 years of doing this work, waiting for help. I've got a massive archive of images, and I do recall finding out what these probably were, but I've lost the name of them. It's buried somewhere in my archives. but this was in amongst the rash. They have a sort of flagella on them, but I can't recall what they may be. I remember there was what I found they were similar to, but unfortunately I've forgotten the name. But they're obviously producing spores. So on this raised rash, these were present, and again, unusual elements. But there are certain elements like this. But as I say, I've lost the name of them, and I can't recall. Now this is still on the stomach, the raised rash. This is part of the scraping. They were very individual, those ones. I just wanted to put them separate. But here you can see the main mass that I've scraped. And if you look carefully there, although it's faintly shown, you can see the massive amount of growths that are coming out of this mass, which we have to conclude is just simply a mass of yeast. And they're the hypha structures just coming out of it, just growing out of it. Again, you can see them there quite clearly. They're just expanding out. Some of these can produce lipids, some of these masses, depending on what it is. But I don't think they're lipids because they tend to form hypha-like structures. Again, this is on the same stomach raised rash. Now that's certainly not a lipid. And again, you can see the cell within a cell. You can see here in the chain, this is obviously probably an arthroconidia chain, and the geotrichum is definitely one of the problems that I probably have that's gone viral in the body. But you can see the same cell in the cell, and it's a chain there. So that's quite typically fungal. Now this is another skin outbreak in February 22 on the torso, and again you can see the same elements there again and again and again. Now these large distinct ones, they've got clear ridges around them. They're not air bubbles. These are ridged elements which appear, and they're part of the problem. And there it is there, just a mass of infection from microspore as they slowly increase in size. Another arm rash in 2022, October, and again we've got these from the same sort of mass of let's say yeast, and again you can see the cell within a cell. Up here you can see the same structure here coming out of this mass. So it's the same structure, the same illness. It's highly neurotoxic now because there's so much in the body. It has reached a critical mass level, and I nearly die every single day now. But I have my own home here, and I'm happy to die here at home because of the way I've been treated by the people in the medical profession in Melbourne. So again, this is a very free-forming sort of yeast structure now. It can sort of bud out everywhere, microspore budding, and it's just the way it's developed over the years that I've been attacking it with various things. We did try oral antifungals. My GP tried to save my life, but unfortunately all the orals failed, and he said you need intravenous. But we fought for 6 years to get that, and no one will give it to me in the specialist field on the public sort of listings. So again, you can see that on the skin arm break on the arm, the same yeast structures are there, and again the same structures here, and you can see spores developing within the spores. So there's beading on the outside, and they're developing spores within the bodies. So any microbiologist seeing these could compare their own microscopy work with these, and they'd have a good idea that this is a neurotoxic bioinfection of fungi or yeast. Now this is the latest one we had in 2024, the last one I've had done. Now this is really stunning because it's becoming much more disturbing to see what it's doing there. But you can see here on the right this biofilm in which they grow in, the microspores, and they grow into these larger chlamydospore type discs. There's plenty more of them there being generated out of this, what looks like some sort of larger fungi mass. And again you can see them distorting and altering their shape. This is all with KOH. There's KOH again, 10%, and you can see them beginning to sort of grow out. Again, you can see the mass amount of microspores that are coming out of what's almost like a thin biofilm mass. And in my lung, that's the coughing there, it feels like there's a really sticky chewing gum like webbing in the lung now. And it would make sense that this thin biomass is in fact, part of the problem. It's become extremely viscous and yet extremely reproductive in its sort of almost like a mycosome spore type reproduction. So here we can see these, again you can see the cell in a cell here, which is slightly elongating, but you can see the clear presence of a yeast or fungi cell there that's in my body. This is from the biopsy chest taken by a doctor, and they give me a sample because they know my pathology, microscopy work is far superior to the pathology labs here in Melbourne. Well, unless we find a good one, of course. We haven't found one yet. So so there's the KOH working there, and you can see the small spores on these strange looking sort of objects, and same sort of thing. These could of course be wax casts coming up from the lung. I call them mud ropes, but they could be wax casts coming up through perhaps lymphatic leakage or something, but they're certainly present in the lungs as well. But here we have back into the fungal problem, the yeast problem. You can see the clear hypha growth there under KOH, high alkalinity happening. And again here you can see various bits and pieces beginning to grow or shoot away. And here again you can see this explosion almost of yeast growth in these very distorted fungal elements. The trouble is we're dealing with something that's been in my body a long time now, and we've used at least 4 or 5 different antifungals, and I use a lot of natural antifungals because of the refusal of the specialists here in Melbourne to acknowledge my illness or treat my illness seriously. And so I have to do all the things myself. But here these large masses seem to almost explode under KOH. Again, you can see the way they're multiplying there, developing hypha structures. And again they're developing these strange sort of growths out from the yeast mass. Same thing here, the hypha, the cells, clusters of cells. And there's the hypha with the typical sort of pinhead on the end really, which is typical of a yeast sort of hypha structure. But that structure there is a pretty typical yeast hypha. These are also there in amongst not only the lungs but in the skin as well. Still unknown sort of thing really what they could be. But these are the really sort of more challenging ones that have come up in 2024 biopsy. This is a disc which has now gone into hyperproduction. So the spores within are breaking out, and all the hypha that you see coming out with the typical pinheads on the end, they are typical yeast hypha, just typical. So where, as I say, they won't report yeast. In Melbourne, Australia, you can die of a yeast infection, systemic yeast infection, poisoning your brain to death, and they'll never report it because I've been told, or the doctors have been told, the pathology labs don't have to report it. And we've had 2 GPs demand they report it, and the labs have refused. They've refused the doctor's request to report yeast. Now that is disgraceful. That is really wrong. And the Australian government has to step in about this really. Biopsy chest, again you can see the structure of these chlamydospore type elements just beginning to explode out and produce hypha. And you just can't stop them, I'm afraid, and they're of course just reproducing continually to the point where I can feel it right through my chest now and the lungs, that's surrounding the lungs and in the lungs. But you can see the hypha structure. Again, you can see this classic pinhead type structure of a yeast hypha coming out of this mass of sort of conglomerate of yeast or fungal yeast structure, fungal / yeast. It's possibly morphed into something else. These are, I'm coughing these up, but they're also clearly here in the chest as well. And again, you've got these really unusual looking elements, but clearly they're not bacterial, and clearly they're quite yeast and fungal like. There it is. This is a deeper focus, so the same image, the disc. The trouble with the pathology labs, if they look at the image on the left, they might just go, oh, it's just some sort of foreign article, forget about it. But if they had a look at a deeper focus, they'd see actually a hypha growing inside it. So the work I do is superior to the pathology labs in Melbourne, mainly because it's my life that's dying, not theirs. So I'd like to know what it is, and I'd like to have evidence to help a specialist provide the proper care and medication that I need. And then we need a pathology lab that's licensed to verify this. So these are why these images are now available on the internet and on YouTube, and you can contact me, of course, about them. But they're the structures. It's a clustered sort of structure of fungal yeast elements, but it's become really, really bizarre now, that's for sure. But it's certainly neurotoxic to the brain, because my whole head is not only going numb, but it's in massive. I've got occipital pain at the back of the skull, and my GP said you need a spinal tap. Well, for 5 years, no specialist will even do a spinal tap for me. He'd do it for me tomorrow, but he's not allowed to. He's a GP. Again, you can see these classic yeast-like pinhead hypha. That is just a classic yeast hypha. Now that's in the adipose tissue of my body, and there are masses of it, masses. And it's going untreated by the medical profession in Melbourne, and unrecognised, and in fact I've been laughed at, told to go and see a psychiatrist by two of the top fungal specialists in Melbourne. I tell you, I wouldn't send my dog to them. So this is the smooth surface that transforms. This is they just begin to really burst out, particularly under KOH, highly alkaline conditions. These things really respond and take off. So they form these outbreaking clusters, and they just continue to mass out into these large clusters, various thicknesses of hypha. And you can see just a simple one hypha coming out of that one. It looks like a smooth disc, but once you treat it with KOH and watch it for a while, you'll realise it's more than just a smooth anomaly, or something that's a bit of a something that's just an additional thing that shouldn't be there. Can't think of the right term for what you call those things, but a foreign object anyway. But it's this is the infection that's in my body that's close to ending my life now. The one on the right's a real classic shot. You've got this smooth disc which producing a hypha with a typical pinhead on the end of it. It's just right through the body. These images are undeniable. To deny that this is there by pathology labs who have said they've found nothing is just absurd. It's just ridiculous. But however, I've sent them these images and I realised that was a mistake. They know I've got the evidence that they are incompetent and negligent at their work, and of course they actually have threatened one GP, and another GP didn't tell me who spoke to him, but he was also threatened, seriously threatened, not to help me anymore. So these are the type of masses growing in the adipose tissue of the chest. You can see the massive growth. It's very distorted. It's very, it's been hit by a lot of things. And so it's morphed, its morphology is altered and changed, and it's quite toxic to the brain now because of the amount in the body, and also it could even be in the spinal fluid. We don't know, because no one will test for it. It's certainly wrapped around the spine. I can feel it there in the thoracic spine. You can see how it breaks out into these clusters. It's just quite an extraordinary looking object, quite deadly to the physical body. But as I say, these things are simply beyond the understanding of the people in Melbourne, unless we can find a decent microbiologist and a decent specialist who's really interested in trying to save my physical life. I haven't found one yet, except for Piers Canty. He was the only one who treated me decently and got me straight into hospital, did a bronchoscopy, and then they said there's no mycology. I said, that's impossible. He said, well, I can't do anything. I can't treat you without their legitimate licensed pathology lab report. It wasn't until a few years went by we discovered they won't report yeast. So it's been a bit of a journey to discover the faults in the system, the corruption in the system. People have been threatened, and people have been blocked from helping me quite deliberately. So this is one of the smooth round discs under KOH that's just blown right out into this mass of growth. It's a really difficult thing. It may be impossible to kill it now because it's been so long waiting for help from the medical profession in Melbourne. It may be simply too late and my body has to die soon, any day now. And okay, if that's the way it is, I don't hate anybody, I want you to know that. In fact, they're the first group of people I pray for. The ones who laughed at me, mocked me, robbed me, and left me to die. They're the ones who need the love from the sort of heavenly spiritual world, because they didn't have any for me, that's for sure. So they need love, So I pray they'll find love instead of just their sort of superiority and arrogance and things that they live out of. So they're really sort of unfortunately difficult things to deal with. Perhaps with some intravenous medication, some intravenous for particularly for yeast systemic infections. There's a possibility my physical body could recover, but as I say, I've seen 20 specialists in Melbourne, and they've all refused to. Only one gave me an antifungal tablet, and that was a third of the strength that my GP had already given to me, and I told him that. He didn't care. He just said, well, take it, and if it doesn't work, stop taking it. And that was the last time I saw him. So he just wasn't interested in doing anything else. So they're really quite, yeah, I think they need to go back to university, but not here in Melbourne, somewhere else, overseas. So you can see the extraordinary shapes of these. Now, the average young person coming out of university who's doing microscopy work in a pathology lab would have no idea what they're looking at here, although they should recognise hypha, particularly yeast anyway. But as I say, the head mycologist at one of our major hospitals here in Melbourne, Australia, had no idea what he was looking at, and yet they were clearly yeast cells. And the specialist I was seeing, who was also a microbiologist in his own right, he also said, I've never seen anything like it. So therefore it can't be in your lungs. And now they're saying, well, this can't be in your skin. But unfortunately, a picture doesn't lie. And as I say, I have a professor who came to my home from one of our universities, Swinburne University, who watched me prepare the slides and gave me a letter saying there's nothing wrong with his preparation, there's no contamination. And a GP, one of the two good GPs who has tried to help me, he also gave me a letter saying, no, his preparation is quite clean and, you know, prepared well, and I can see things in his images which clearly aren't bacteria, although I won't comment what they are. Of course, they don't comment about what they are. That's the job for the professionals who won't help me. But you can see here how these have become the morphology's really shifted dramatically. And so you've got sort of hypha-like yeast, but they can also be fat, sort of broad growth. So it's, and you can see the microspores. I mean, look at all the microspores here. So what chance have I got of survival, do you think? I mean, I'm nearly poisoned to death now. I'm nearly paralysed, and I've got almost continuous meningitis type pain. And I'm in Melbourne, Australia, with no one helping me, except two GPs who have given me all the antifungals tablets they can. Now, again, here you can see the classic structure of the hypha and the pinhead on the end of a yeast. Yet they won't report yeasts in Melbourne. Yet I'm dying of what appears to be a massive yeast systemic infection. They won't report it. You don't get treated, you die. So this is in Melbourne, Australia. I'm shocked that they're so pathetic at this. It's just unbelievable. But there you go. I guess, you know, these things are here to learn, and I'm here to share this knowledge with, with the world and with people in Melbourne who have got a serious yeast or fungal infection. Get out of Melbourne. That's what I tell you. The people at the universities told me get out of Melbourne. They're no good here. They tried to line me up, as I say, with the one person they thought could really help me, and the head of the department found out, and he was blocked from helping me, and that was evil. What that person did was evil. But we won't go there. I pray for that person. So we can see these images. You can see the clear disc on the left here. Clear disc. They don't look very innocuous. You think, oh, that's a clear disc. So a young person in a pathology lab might just go, oh, that's probably just something, particularly if they've stained it. Yeah, it's nothing important. But that disc becomes this. And out of this comes all these hypha and yeast structures. But if they don't treat it with KOH in particular, which they won't use, as I've been told they don't use KOH, if they did, this particular yeast responds and it goes into hypha reproduction under KOH, high alkaline conditions. So they don't listen to me. They throw all these images in the rubbish bin. They don't like me having them, of course. What? You've got a brain? Oh no, get rid of him. He knows how to use a microscope. Again, you can see here the circular discs that if a young person in a pathology lab had a look at that, had a look at these, they think, oh, that's probably just something, some anomaly, something, it doesn't matter. And even if they stained it, and even if it was yeast, they still go, it may just be yeast, we won't report, that's commensal. Well, it's commensal, sure it's commensal. But that means if someone's dying of septicemia from bacteria, and a doctor sends in a sample and says to the labs, let us know what bacteria is killing this person, they're dying of septicemia from a bacterial infection, it'd be like the lab saying, well, we're not going to report any bacteria. We don't have to do that. And the person dies from bacterial septicemia. What they're doing in Melbourne, Australia is saying, we don't have to report yeast, that person can die from yeast septicemia. We don't care. It's just shocking. It's unbelievable. It's unbelievable. It really needs, I need to speak to the government about this, but I haven't got time. I've got to prepare to die or find a good person to help me. So you can see the hypha here on the right coming out of the disc. So these are the discs, and then this is what's inside them, and this is what comes out of them under KOH, 10% I use. Again, if you saw these discs without any of these objects growing, they don't know what they're looking at, and that's the trouble. So I realise these are unusual, so I do have some sympathy for them, but that's their job. It's not my job. I'm a gardener, horticultural trained gardener. I can do this work easily because I've been trained to use a microscope. They are supposed to do this, and not only do this, but identify it and then discover which best antifungal treatment is best for this, and then find it in the system and go, blimey, this guy needs intravenous. Hurry up, get it into him. But instead, they say, nothing there, no, nothing there, no, that's nothing. Again, you can see this extraordinary growth pattern of these discs of what we have to describe as yeast fungi. But it's probably a distorted yeast by now. It's probably a really modified yeast morphology now. But you can see them there. It's quite clear. This is 2024. I haven't bothered having another one after that because I thought, what's the point? You know, no one listens, no one cares. They're useless at their work. So we're hoping to find someone, and I will be seeing 2 specialists again soon, and we're hoping to get these images to a microbiologist who gets a sample, and then they only need to look at my images to check with their own licensed pathology microscopy work. We may have to send it not only interstate but overseas. That's how bad things are, and certainly Melbourne. But if they can see my images and compare with what they're looking at least they'll have a confirmation that yes, we're seeing this thing too. Then of course it's up to them to grow it in the lab, which I had to do here at home. And then of course hopefully discover what would be the best antifungal to use for it. And then give it to me. Tell the specialist to give this guy a huge bucket load of this stuff, you know. And that's the trouble. So I can laugh about it because of my spiritual background, you know. There's another life coming after I die. I'm not too concerned about that. But this is very wrong the way I've been treated here in Melbourne, and these images are very important, and I'm happy to teach the pathology labs and the specialists here. I'm happy to share this information with them. I don't want to sue any of them. I'm happy to go on TV about it though and expose them. I'd be happy to do that as well because of the importance that people could be dying of these systemic yeast infections in Melbourne and around Australia, and no one's reporting it and no one's treating it. And then your heart eventually seizes. And the autopsies aren't done properly. If they do the autopsy, they'll send this thing to the pathology labs who don't report it. So it's a real terrible situation, and they just need to wake up, you know, just learn something from me, you know. You can die from a systemic yeast infection. This is what it looks like when it's in the body. Wake up. And they should have these on file. They should have these at universities. They should use my images at universities to show potential microbiologists, pathologists, this is what can happen to a patient who's left untreated and trying to treat himself for years by himself. This is how these yeasts can their morphology can shift and alter. This would be very important for universities around the world, really, as long as well as here in Melbourne. So these are the main images on these. What it's become now is really, really out of control now. But you can see these images on the left here. They're the same small discs that were always there, even right back in 2019 when the first biopsy was done. In fact, that almost looks like the 2019 biopsy. So it's still there. And the chest was well prepared with alcohol rub and all that sort of thing when they did the biopsy. This isn't a skin surface commensal yeast. This is a deadly neurotoxic mass, and it's at a critical level of mass. It's a critical mass level, and it's poisoning my brain to death every day. I use a freezer now, cryotherapy freezer here at home, to stop the fungus from killing the body completely, or the yeast. It knocks it back a bit. So there's some more images. So if you see this in anyone's biopsy, you can be sure that they could have a serious, deadly, neurotoxic fungal yeast infection, and it can kill them, because it's certainly nearly ending my physical life here on Earth, and it's massively neurotoxic to the brain. So you can see the way these discs appear, and they clearly have these different shapes and take on different morphologies and shapes and then that's about the way it is. so they're the images, and I can be contacted. So as I say, that's what I'm coughing up from the lung. I can hardly cough it up anymore now. And the head mycologist at one of our major hospitals in Melbourne had no idea what that was. In fact, the specialist said to me he thought it was some sort of vegetative thing. I went, wow. I'm a horticulturalist, like I'm a trained gardener, you might say, and I know about yeast. I mean, grapes and fruit have a yeast plume on the fruits and things, and that's how wine's made through yeast. I know what yeast looks like, and I know how it's involved in gardening and things. And yet the head mycologist had no idea what that was at a major hospital. So I pity the poor people who are in that hospital and any of the hospitals in Melbourne, because they'll never report this. They'll say, well, we don't know what it is. And the specialist said to me, well, that couldn't be in your lung because I've never seen it. I mean, you've got to laugh, because if you don't, you're going to cry. You have a mental breakdown, commit suicide, But of course, I don't have to do that because I know they're wrong. So I'm the one dying, I'm the one who's experiencing it. But I share this knowledge, and these images are really, we're hoping to find a microbiologist in Australia, Melbourne in particular, who's in a pathology lab that can, swallow its pride, so to speak, and do a proper job on this, do proper microscopy work. They're going to have to look at my images, though. That's why it's on YouTube. So a specialist, hopefully we can find someone, and the specialist can refer them to this video, and that's why I'm doing it. If they look at this video, then they examine the biopsy of the skin punch, at least we can verify from a licensed lab, finally, that yes, there is a massive amount of something that looks like yeast there. Even if they're not sure what it is, they should culture it and they should find out. They can do PCR testing, DNA testing, things on these sorts of things now, but they, of course, the trouble is finding someone. So that's the problem. So I share those images with you, though, because it's really quite difficult for me. If you wish to contact me, there we are, jcinfocus@gmail.com. That's jcinfocus@gmail.com. So if any microbiologist in the world wishes to contact me, just send me an email. I've got about 10,000 images, so they're just the skin images. The lung images are spectacular as well. So I'll leave that with you, and I certainly hope it helps mycologists around the world and microbiologists, particularly in pathology labs. If you've seen this video, then you're looking at a person who's dying in Melbourne, Australia, untreated, and yet look at the evidence. So the yeast is going it's unrecorded. Pathology labs actually refused doctors' requests to report it. I was shocked at that, totally shocked. So there are really serious problems here in Melbourne, Australia, and probably around the rest of the country. So at least I'm exposing this serious flaw in the system, and around the world, of course, I know other countries are way more ahead, far advanced than Melbourne, Australia in treating fungal infections that have much bigger populations. But these images of mine may be very useful, particularly in universities. I'd say these images could be a real help at universities, and I'll be happy to send a PDF copy to any universities or any lecturer who wishes to use them. Just contact me, and I'll put together a PDF USB or something, and or put it on the cloud or something where you can download it. But I'm more than happy to provide it so that you can include it in a systemic, deadly neurotoxic systemic fungal yeast infection that a patient was dying of, left untreated, going unreported because they didn't have to report yeast. So it's a really stunning example of how we can make the system better through the patient providing the evidence. I'm offering it, I'm sharing it, And you know what they say? Get lost, but pay on the way out. So there you go. I hope these images are of some assistance around the world. As I say, they make a wonderful addition to any lecturer's lecture who wants to lecture about fungal mycology diseases in the world. These images you won't find on the internet. As I said, I'm a trained graduate of a horticultural college. 50 years ago I was taught to use a microscope. I've always loved using it. It was easy for me to change from looking at fungi on leaves and little insects to what's happening in my skin or my sputum. It was quite easy. Bit of a learning curve, of course, and then I ended up just doing wet mounts because they were simpler. I'm not in a lab, I don't have all the necessary stains, and I didn't need stains. The main thing was consistency so that you could see the uniformity of the infection. Stains just can make things a bit foggy, and I'd have to get all the different stains, so I didn't bother going at that. I just kept it uniform, and the wet mounts are brilliant in the sense that you've got a uniform example of a deadly neurotoxic systemic fungal yeast infection. Clearly yeast is involved, going completely untreated in Melbourne, and I've literally been left to die in agony. And you're talking 20 specialists in Melbourne. And 2 of the top fungal specialists said, go see a psychiatrist. I said, what about all my symptoms? What about these reports? Oh, just see a psychiatrist, we're not doing anything. And they throw all the reports in the bin. Got about 7 reports of different fungi and another about 8 independent reports from other labs. And from the United States, where I've sent a sample over and yep, your body's full of mycotoxins. All thrown in the rubbish bin. So by the specialists. Quite stunning. Very sad, of course. They need to lift their game. So I pray they do. I hope this helps mycologists around the world. I'm Christopher Morgan in Melbourne, Australia, fighting for his life from a deadly neurotoxic fungal yeast infection, going untreated by the medical professionals here in Melbourne, and we're hoping to find maybe 1 or 2 soon that might be able to find a decent pathology lab who can at least verify the skin biopsies, and we'll see what happens. But I could easily die tomorrow, so not to worry. Bring a little love to earth while you're here. Love your family, love your friends. When people persecute you, like I've been persecuted here in Melbourne, and people have been threatened who are helping me, it's been quite evil what they've done to me. Always forgive them. I have no hatred in me for them at all. No hatred whatsoever. I feel sorry for them that they're so incompetent and negligent and so arrogant. I mean, it's unbelievable. And they don't want to learn anything from me, the patient. You know, I'm just a piece of dirt, you know. So I thought, wow, you know, you've really missed the boat on the, you missed the love boat, you know. You need to go and meditate on love for a while, you know. So that's all I can do really, is just sort of pray for them. That I'm sure they perhaps love their family or something, but they sure didn't love me, that's for sure. Anyway, love is the answer to all our problems in the world, but you have to become at one with love. Otherwise, you could become part of the problem, as we know. Okay, well, bye from me here in Melbourne, Australia. I hope these images have been interesting. And as I say, I'm a case that's a patient that's nearly dying. There it is there. So I'll go now, and all the best in your life. Bring a little love to earth. Bye.